Hi, my name is Sandy Peralta, and I'm going to talk about metformin versus placebo in obese pregnant women with diabetes mellitus. Obesity during pregnancy is associated with an increased risk of adverse short-term or long-term consequences for both mother and baby. Attempts at reducing the incidence of pregnancy complications associated with obesity have focused on dietary and lifestyle interventions, but these have generally been unsuccessful. An alternative strategy is the use of metformin, which reduces insulin resistance. Metformin has been used extensively in the treatment of gestational diabetes mellitus, and there has been no evidence of an increase in the incidence of birth defects associated with its use. Hyperglycemia and increased insulin resistance occur with obesity and may explain the association between obesity and fetal macrosomia as well as other pregnancy complications. Here we have a video.
Metformin is used with a proper diet and exercise program and possibly with other medications to control high blood sugar. It is used in patients with type 2 diabetes. Nausea, vomiting, stomach upset, diarrhea, weakness, or a metallic taste in the mouth may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Metformin can rarely cause a serious condition called lactic acidosis. Stop taking metformin and get medical help right away if you develop any of the following symptoms of lactic acidosis: unusual tiredness, dizziness, severe drowsiness, chills, cold skin, muscle pain, difficult breathing, irregular heartbeat, stomach pain with nausea, vomiting, or diarrhea. We advise you to do a bit of research yourself before you buy any treatment for type 2 diabetes.
Okay, continuing. Studies involving women with gestational diabetes mellitus have shown that metformin reduces gestational weight gain. The metformin in obese non-diabetic pregnant women MOP trial was designed to test the hypothesis that metformin as compared with placebo will be associated with a lower median neonatal birth weight score when administered to pregnancy women with diabetes who had a body mass index of more than. In this study, we randomly assigned women with diabetes who had a BMI of more than 35, more than 18 years old, were at 12 to 18 weeks of gestation with a singleton fetus to receive metformin or placebo. Participants were from three National Health Service (NHS) maternity hospitals. Here we have another video.
Let's talk a little bit about obesity and pregnancy. First of all, it's important to know that obesity does affect fertility. So if you are obese and you're having difficulty getting pregnant, maybe talk to your doctor about ways that you can try to lose weight and hopefully improve your fertility. That being said, people who are obese and get pregnant can have a trickier pregnancy. Obesity and pregnancy can lead to gestational diabetes, which can lead to larger birth weight for the baby and maybe even low blood sugar in the baby once he or she is born. So a healthy pregnancy really is one where you have a healthy weight if possible. If you're trying to lose weight and also want to get pregnant, a good piece of advice is try to wait until your weight loss has plateaued before you get pregnant, because then your body will be better able to support yourself as well as the developing fetus. I have patients who want to get pregnant after weight loss surgery, and it's perfectly safe to do so. However, we do recommend that patients wait at least a year, sometimes a year and a half after their weight loss surgery to get pregnant. Therefore, their weight loss has plateaued and they're more likely to have a healthier pregnancy and a healthier baby. So the take-home message really is a healthier pregnancy is possible if you're at a healthier weight.
Okay. The primary outcome measure was the median neonatal birth weight S-score, a difference between observed and expected birth weights with adjustment for gestational age divided by the fitted standard deviation, the expected birth weight. Maternal secondary outcome measures included gestational weight gain, which was defined as the difference in maternal weight between the day of randomization and the last antenatal visit, gestational diabetes mellitus, preeclampsia, pregnancy-induced hypertension, delivery by cesarean section, and the postpartum hemorrhage, which was defined as blood loss of 1 liter or more.
Tina Thomas. I'm obstetrician and gynecologist. Low birth weight babies are defined as live born weight of less than 2.5 kgs or 5 pounds and 8 ounces. Less than that, irrespective of the period of gestation. So, any baby is born less than 2.5 kg is low birth weight. There are many causes. The most important can be inherent. A low weight mother, a small built mother, can have a low birth weight baby, which is called small for gestation. Then the other causes of low birth weight may be a preterm baby before the dates, or smoking in pregnancy causes, any medical disorders in pregnancy like blood pressure or diabetes. These can cause low birth weight babies, or nutritional deficiencies. In India, most common cause is anemia causing low birth weight babies. So these are some of the causes of low birth weight babies.
Okay, continue with this. There were no significant differences between the metformin group and the placebo group in the median neonatal birth weight Z-score. The incidence of large for gestational age neonates for the incidence of adverse fetal or neonatal outcomes. The median gestational weight gain in the mother and the incidence of preeclampsia were lower in the metformin group than in the placebo group, but there were no significant between group differences in the other secondary outcomes. Side effects including nausea and vomiting, diarrhea, and headache were as expected during gestation, but the incidence of side effects was significantly higher in the metformin group than in the placebo group. Here we have another video that we're going to see now. Symptoms of pregnancy. A missed period, abdominal cramps, bloody spotting, fatigue, morning sickness, irritability, irritability, frequent urination, and number one, aversion to certain smells. Okay, continuing with the exposition, we found that among obese women, less gestational weight gain was associated with a lower prevalence of preeclampsia. This finding is compatible with the results of several previous studies that show that the prevalence of preeclampsia increased with both increasing pregnancy BMI and increasing gestational weight gain. In conclusion, in pregnant obese women without diabetes mellitus, prophylactic therapy with a daily dose of 3.0 g of metformin from 12 to 18 weeks of gestation until delivery was associated with less maternal gestational weight gain than that observed with placebo, but not with a lower median neonatal birth weight. And we will see the last video.
There is definitely a significant number of pregnancy risks related to having higher weight in women once they're pregnant. There are risks, and the way we think about those risks are what are the risks to mom and what are the risks to the baby. So there's an increased risk for mom in terms of having higher blood pressure. So we call that pregnancy-induced hypertension. And in worst case scenario, that can progress to something that we call preeclampsia and eclampsia, which is in fact a medical emergency. That's more common. There's also an increased risk of gestational diabetes. And gestational diabetes is also a marker of increased risk for developing type 2 diabetes postpartum. There is an increased risk of having to have a C-section, so actually a marked increased risk of having to have C-section. So women who are overweight or obese, the risk of C-section is somewhere close to 35 and even 40% in some places, which is much higher than what we hope to achieve in most situations. They have a higher risk of having to have a surgical procedure to get the baby out, because even if it's not a C-section or forceps or vacuum extraction, because the babies also tend to be bigger, so they're harder to get out. When mom has a surgical procedure, there's also increased complications. So C-sections are associated with some risks of their own, including blood clots post-operatively, and high body mass index also independently increases the risk for blood clots. So that's something we worry about for women who are overweight.
Thanks for watching and have a nice day. Bye.